We are now nearly 2 years into the pandemic, and it's taken a toll on just about everybody, especially our healthcare workers.
And now joining us live is Daniel Ross, president of the Hawaii Nurses Association. And Daniel, thank you so much for spending part of your New Year's Eve here with us tonight. So tell us, first off, how are nurses and healthcare workers holding up as this pandemic drags on?
In general, I'd say we're exhausted. It's been hard on everyone throughout the community, but especially healthcare workers, and especially now with our second big surge going on right now, the levels of overtime and especially mandatory overtime that has been put on nurses throughout the state is just untenable. And it really is contributing to the shortage because it's burning people out and it's chasing people away from the profession, from the jobs. We went into healthcare to help people, but we're not martyrs, and we can only take so much. So it's tough.
What kind of support have the hospitals been able to provide, or the unions been able to provide to help these people get through this burnout? Anything?
Well, I mean, efforts have been made, but it's few and far between, right? Because the Queens, for instance, which is our largest facility in the state, private facility anyway, they have contract language against mandatory overtime. So they've been primarily offering incentives, or give you a monetary incentive for picking up extra shifts. There's only so much you can do with that. And as a matter of fact, just today I had to file a cease and desist with Queens because they started violating the contract. I think the upper levels don't know about it. The lower levels did, so we put them on notice, and hopefully we'll get that stopped. But most of it, that's the only place in the whole state where we have any contract language against mandatory overtime. There's everywhere else they are mandating nurses to work. They're working multiple back-to-back 16-hour shifts. We have nurses who have been mandated to work 20-hour shifts. I mean, anyone who thinks that is safe in any way, they need to think again, because it can't keep going on this way. And I know that we're going to begin FEMA nurses coming through again, and that will help tremendously. It helped a lot last time it came, but it's not enough. This is a long-term problem throughout the state. The hospitals and the SNF facilities have been short-staffed and underhired for years. This problem so I really do lay the blame at administration of the hospitals for years of underhiring, because they couldn't, when something bad like this happens, there's no reserve, there's nothing to go on, because we were staffed to bare minimum as it is, and hospitals have been full pretty much ever since St. Francis closed down. Queens has been running full census. I know some of the other hospitals, smaller hospitals, hasn't been the same situation, but lately it has been, and it's I don't want to sound too pessimistic. We're hopeful, because right now with this current surge, we're seeing huge numbers, but the seriousness of the illness doesn't seem to be, for the most part, as bad. Sorry.
Yeah, and that's what I wanted to ask you. No, it's fine. You're working from home. We all understand. No, we wanted to ask you, you mentioned the severity. It seems a little bit less, but what are you seeing in hospitals right now in terms of patients? What kinds of things are you seeing on the front line?
Well, it's only in the last few days that it's really started to pick up. And we see, with the previous surge, Queens primarily took the biggest hit. With this one so far, it seems to be spread out a little bit more. And that's probably a reflection of being cases that are not quite as serious. So they're able to stay on the med surge units. So the ICUs, when I met with management at Queens yesterday, and we got a lowdown on it. The ICUs, there were only 7 COVID patients in the ICUs as of yesterday. I didn't get an update today. 4 of them were on ventilators. And we had 60 patients throughout the system, throughout Queens yesterday. So that number has been rising. It was, last week, I think it was like 20 something, 30. So it's rising pretty quickly. They're getting ready to start, with the surge. They dedicate units for COVID, and so they start opening up different COVID units. And so they've got that set, and that process is going now. So we expect that that it will continue to expand. The good point is that people don't seem to be as seriously ill as last time, so they're not taking up the ICU beds as much, but they're still filling up the hospital. There are still fatalities. There are still serious cases, not to the number of before. Just the general number can be quite inundating. We got close to completely filling up all the beds, but the point is we can fill all the beds. We don't have the nurses. We don't have the staff to take care of those people, whether they're COVID or whether they're a fireworks injury or what, right? It's like we expect, Queens being the trauma center, they're always expecting New Year's Eve, they're going to get an influx of traumas.
Daniel, I was wondering. I was wondering, do you guys just get frustrated because maybe a lot of these hospitalizations, these cases could be prevented if people would just simply get the vaccine and get the booster?
A lot of people do, yes. That's a common sentiment, but I have to say that nurses represent the community we live in, and so there is a segment of nurses who don't agree with vaccination. They do the masking and everything else, but there is a minority who feel that way, and as their union president, we have to represent their view too. Personally, I encourage everyone, and this is the union's official position, is we encourage everyone to get vaccinated. So it's a little bit of a moral dilemma for some of us, but I know I have people on extreme ends in my membership who are on me. Why aren't you pushing harder to force everybody to get vaccinated or to have them not work if they're not vaccinated? And then I have others saying, why aren't you protecting our rights strongly enough? So it's a balancing act there. I think if we take all the proper precautions, I do encourage everybody to get vaccinated, and that includes getting the booster. I know the numbers for the booster have not been that great in Hawaii yet. Hopefully that will increase, because if you look at the numbers of the people who are hospitalized, by far the vast majority are unvaccinated. The next would be vaccinated but not boosted, and then vaccinated and boosted would be the smallest number. So it seems kind of sensical that if you have all that protection, it's going to help. It's not a guarantee. You can be wearing a bulletproof vest and get shot and still get killed or injured, right? Your chances are a lot better. But so it's the same with the vaccine. It's not a guarantee that you're not going to get it. It's not a guarantee that you're not going to get sick, but it's going to improve the chances a lot better. Yeah. So we would encourage everyone to do it. It's very difficult. There is that compassion fatigue element out there. That's kind of a catchphrase that came out last year, where some people do feel that they're busting their butts to take care of them, and people aren't doing their own part in it. You see all these interviews with someone, I wish I changed my mind that I got so sick I got the vaccine. But people are people, and we can't force them. We do live in a free country. We just do our best to try to convince them. Our dilemma in nursing is right now with the way it's going now, is we do not have enough workers. This is nurses, aides, and other ancillary health respiratory therapists on down the line. There's just not enough people. The biggest hit right now, what's going on, is because nurses and other healthcare workers are getting COVID, and we're getting quarantined because our spouses and family members are getting COVID. So that's deeply affected our staffing, just like you hear about in the airlines, flights getting shut down because the staff are being quarantined or positive COVID. Well, the same thing's happening with the healthcare workers. So that's on top of all of it too. We're already short, and we've got multiple people out. Yeah. And then you're wearing down the ones that are working.
We can't imagine how it must feel for healthcare workers right now. We really appreciate everything that you're doing, that they're doing, and we really hope that things get better sooner than later. But thank you so much for your time tonight. Unfortunately, we do have to wrap up the interview, but Daniel Ross, president of the Hawaii Nurses Association, thank you so much for stopping by.
Thank you. Nice to see you.
We appreciate it.